Welcome back to the Dreamers Podcast, where we sit down with professionals who redefine their fields and try to motivate the next generation of students. I'm Asman Musa.
And I'm Muir Rahman, and today we're joined by Dr. Gregory Scott Brown, who is a board-certified psychiatrist and educator at UH School of Medicine, chair of communications at American Psychiatric Association, author of the best-selling book, The Self-Healing Mind, and a national voice featuring everywhere from the New York Times to PBS to Men's Health.
He is also one of the leading voices in integrative and lifestyle-based mental health, speaking not just to doctors, but also everyday people trying to survive burnout, anxiety, and the pressures of modern life. Dr. Brown, welcome to the Dreamers Podcast.
Thank you for having me. I'm excited to be here.
Oh, thank you so much for coming on.
We're going straight into the first question. So the first questions are about your journey before medicine. I saw that you studied music at Juilliard in New York.
I did. So in my previous life, I was a classical oboist.
Okay.
Wow.
So out of high school, I went up to New York City. I studied oboe performance there for 2.5 years before changing my mind and deciding to embark on a long road to a career in medicine. So I ended up moving back to Houston, attended Rice University, did a post-bac at Johns Hopkins, and then ended up starting medical school. Here I am.
That's great. Yeah,
Amazing
very
journey.
untraditional path, but
Yeah.
I feel like it has made you the doctor that you are today. So,
Absolutely.
Great. And following up on that, what was the switch that pulled you up from art into medicine or psychiatry in general?
Well, I'll tell you. So when I was a kid, medicine was something that I always found intriguing. So if you asked me what I wanted to be when I grew up, when I was a kid, I would have said doctor 100% of the time. I was involved in a lot of extracurricular activities. Music was one of those activities that I happened to be very good at. I happened to enjoy a lot. And I found myself, winning a lot of competitions in classical music. And that just seemed like it was the next best step. But I would say when I was at Juilliard, I did spend a lot of time sort of thinking about my career trajectory and what I really wanted to do with my life. And at the end of the day, that was medicine.
Amazing. I love that. And do you ever think your education in music gave you a different understanding of people's inner worlds, the kind that psychiatry textbooks may not be able to teach?
Oh, 100%. I mean, there's so many lessons that I learned from music, not only when it comes to the discipline of having to prepare for performance, preparing for being able to sit down with folks like you two and, perform on a podcast, but also, the different personalities that you have to work with, in music, being able to strive for a broader goal and artistic performance. I mean, I think all of those are valuable lessons that you can apply not only to psychiatry, but into various fields in healthcare.
Amazing. And I want to bring up a point that you have made, that healing is both scientific and spiritual. How do you balance those two in your practice personally?
Well, I'll tell you, spirituality is probably one of my favorite things to talk about in mental health care. And I'll tell you why. I mean, I think a lot of times when people think about spirituality, the number one word that comes to mind is religion.
Yeah.
Right.
Yeah. Mm-hmm.
But it's important to note that spirituality is a much broader term. Now, when I sit across from a patient, 99% of the time, if I ask them, is spirituality important for your mental health? They're going to say yes, regardless of whether they're religious or not.
Great.
Now, spirituality, in my view, is all about connection, right?
Mm-hmm.
It could mean connecting through, connecting to a higher power through prayer, connecting to God if you happen to be religious, connecting with your environment, connecting to the people around you through altruism, selfless service. I mean, these are evidence-based strategies that have proven to reduce anxiety, improve symptoms of depression. So it's a very important concept. And I think physicians should be more open having those conversations with our patients.
I agree. We need more physicians like you to talk about this type of stuff, because I don't hear this too
Right.
often. So
Yeah,
that's
right.
amazing.
Right.
Thank you. And we're going to move on to the next set of questions.
So kind of interesting questions for you is, I've seen you worked as a research coordinator in addiction psychiatry at Baylor College of Medicine, and you co-authored several peer-reviewed studies on stimulant addictions. What's your opinion on algorithm-driven social media scrolling, and especially in today's environment?
That's a really important question.
Yeah.
And it just reminds me. So when I was applying for residency, I approached a mentor of mine who was a neurologist, and I asked for a recommendation letter. And she said, why do you want to go into psychiatry? And I remember saying to her, because psychiatry is not an algorithm-based specialty. And she said, well, neurology isn't either, right? Which just goes to show that there are algorithms in medicine, there are algorithms in research, right? But it's also important that we are able to think outside of the box, not only when it comes to, practicing medicine in the clinic, but as you mentioned, social media based algorithms. I mean, if we're just looking at how do we get from point A to point B to point C, then we might be missing some of the nuances there in medicine. Another thing I'd like to say, just when it comes to, being a clinician here, if we're only focusing on algorithm-based practices, imagine I see a patient who's struggling with depression. And I know that, the next best step to help this patient get better is to recommend an SSRI, selective serotonin reuptake inhibitor like escitalopram, Lexapro. But for whatever reason, this particular patient does not want to take an SSRI or doesn't want to take a medication in general, right? So if I'm just stuck on the algorithm, depressed patient, this is what I'd recommend. They're saying, no, I don't want to do that. I could easily say, well, since this is outside of the algorithm, this is someone I can't help.
Yeah.
That's not the case, right? So that's where we really have to sort of think outside of the box, break away from some of those algorithms. And I have to ask myself as a provider, okay, what are some other evidence-based options that might help this person? And that's when we go into some of these discussions about nutrition, breath work, mindfulness, spirituality. And that might offer a bridge back to some of those algorithm-based practices like the SSRI.
And I feel like thinking outside the box, that's where a lot of innovation even comes from, is like physicians that thought outside the box, and you see all these new innovations coming through.
I mean, think about germ theory, right? I mean, or just, someone just sitting around, doing research, in general, oftentimes does require us to think outside of the box, to challenge the status quo, and then have conversations like the one we're having right now and convince our colleagues and convince the general public, and share with them the findings that we've been able to glean from thinking outside of the box.
Yeah, 100% agree. And another question I had was, in your opinion, especially for, I guess, internet use, you think digital engagement can rewire the brain's reward pathways in a way? So
there's some research actually looking into this. I wouldn't say that at this point the research is equivocal. As far as, sort of like dopamine detoxes, I had a conversation with a researcher at UCSF about this. Dr. Adam Gazzaley, who actually got a video game FDA approved called NeuroRacer for pediatric ADHD, right? And so I asked him about this, and he said, there's some evidence that suggests that this is an area that we should be paying attention to. But as an evidence-based doctor, I can't say at this point that it's just cut and dry. Yeah,
exactly. And I feel like for us, like growing up with, I guess, technology and like video games, I feel like, especially now with Instagram or like TikTok or the scrolling, I guess.
It's that
doom scrolling.
Doom scrolling. It's like, it's really has kind of taken my attention span a little bit down, I realized.
Right.
Which, again, no like real research, but I feel like down the years, we might see like something like that coming in.
Well, I'll tell you, I mean, there is some preliminary research indicating that attention spans are becoming shorter.
Yeah.
Right. Now, what's the reason, with the cause and effect? I mean, I think that's the area where we're still sort of looking into that. But I will say, that I think most people would agree that, social media, screen time, I mean, has had a profound effect on our mental health.
Yeah.
And it's something that is definitely worth paying attention to.
Yeah,
I agree.
100%.
I agree. Yep. Wonderful. Now I want to talk about your best-selling book, The Self-Healing Mind.
It's a good one. I've read it.
In The Self-Healing Mind, you outline 5 pillars of self-care: breathe, sleep, spirituality, nutrition, and movement. Which one do you find people abandon first when life gets overwhelming?
Well, I'll say the one that I think people don't pay enough attention to is breath work. Right.
Oh, interesting.
And I'll tell you why. Each of us takes between 20 and 30,000 breaths a day, right? And unless you have, some sort of pulmonary condition, like asthma or COPD, I mean, most of those breaths go unnoticed.
Yeah.
Right. And in my view, breath work is one of the most underutilized tools when it comes to mental health.
Yeah.
Right. So you take a deep breath in, deep breath out. You have the potential to increase the concentration of GABA, in the central nervous system. Right. You can increase the presence of alpha waves on EEG. Right. I mean, these are physiological signs of rest and relaxation, right?
Mm-hmm.
So I can remember a story here. When I was in residency, I was covering an inpatient unit, and I got a call from one of the nurses that an elderly patient was having a panic attack.
Mm-hmm.
And the nurse asked me if I would call in a prescription for alprazolam, for Xanax,
Mm-hmm. Yeah.
right? Without even seeing
The patient.
Yeah.
and this is something that's done all the time. And we know as physicians, there are risks with benzodiazepines,
Yeah.
like Xanax, especially in elderly patients. Around that time, I was sort of beginning to learn about some of this research surrounding breath work, which, by the way, is not new.
Mm-hmm.
But interestingly, it's becoming more popular integrative approach to health and wellness. And so I remember, instead of just saying yes to the request for Xanax, I went down to the floor. I sat with the patient, and we did a couple of rounds of 4-7-8 breathing together. We inhale, count to 4, hold, count to 7, exhale, count to 8.
Mm-hmm.
3 or 4 rounds of 4-7-8 breathing. The patient was calm, relaxed, and I didn't need to call him Xanax,
Mm-hmm.
right? So again, not to say that every single time someone is experiencing anxiety or panic that breath work is going to work, but it's at least something to try before we jump right into the
medications. Especially like giving a patient medication like Xanax. I feel like breath work is way better alternative in general. And also, you taught me something new, because again, breathing in general just seems like a normal reflex that we're doing, but I never thought of it in that way.
I wouldn't have either.
Yeah.
Right.
Really
and there are no side effects to breathing either.
Exactly.
Just makes you feel good.
What do you think about this new approach of like people using mouth tapes while going to sleep for better breathing? Do you think is it effective?
Well, I mean, here's what I have to say, because there's a lot of wellness hacks going on right now.
Yeah.
And some of them will pan out as, end up being evidence-based, and some won't. I think it's really important that we understand that there's hype and that there's science, right?
Mm-hmm.
And we don't want the hype to get ahead of the science. So whenever I see these hacks online, I don't ignore them, because patients are going to ask about them.
Yeah.
I pay attention to them. And then I look and say, what does the research say here? And sometimes it's just a matter of, okay, let's wait and see how this pans out.
Mm-hmm.
Great answer. I like that. And I feel like you already mentioned a little bit about this, but when you meet patients who are skeptical of medication, but are open to self-care, how do you bridge that gap without losing the science behind it?
Well, I mean, I think the important thing is, and in my book, so The Self-Healing Mind, these are all evidence-based techniques.
Mm-hmm.
So I'm an evidence-based person. I believe in science. There are a lot of people out there, even some physicians, who sadly are willing to compromise their integrity to sell books or to become famous or whatever, and they lose hold of science. That's not me, right? So sleep, spirituality, nutrition, breath work, movement, the 5 pillars of self-care that I outline in my book, these are all evidence-based strategies.
Yeah.
And so, if a patient of mine didn't want to take a medication, for example, and sometimes these are difficult conversations. I've had patients who have a diagnosis of bipolar 1 disorder. And they'll tell me, I really don't want to be on a mood stabilizer. I want to make dietary modifications instead. The evidence doesn't support that.
Yeah.
So that would be a case where I would say, well, the evidence says that, the best treatment for this condition is a mood stabilizer. Now, we can incorporate some of these other self-care strategies along with that. But if you want the best case for getting better and feeling better, this is what I would recommend.
I like that.
Yeah.
And you yourself work at a College of Medicine, UH College of Medicine. So if every medical school required future doctors to master one non-clinical skill, what would you choose and why?
Nutrition, man. We need to. I didn't learn any nutrition in medical school, and it's so important. Like learning how to read a food label, learning about saturated fat and omega-3 fatty acids, and I mean, just imagine how many chronic conditions we could improve if as physicians we were talking about nutrition with our patients. So any med students watching this, my med students know I somehow find a way to incorporate at least a little bit of nutrition in every lecture I give, but learn how to read a food label. It's a very powerful skill to have.
Yeah, 100% agree.
Wonderful. We're going to move on to our segment 4.
Now, kind of, I guess, mentoring the future generation. What would you say, like, to our audience, mostly our like med students and like students in general, and whoever often feel overwhelmed? Like, what's your message to kind of overcome that overwhelmness or being burned out? Because I feel like that's a big problem in undergrad or even med school that we're seeing now.
And in general,
Yeah.
Right? So there's some research indicating that up to 90% of people at some point experience symptoms of occupational burnout.
Mm-hmm.
And I believe it was in 2019, the World Health Organization actually recognized burnout as a clinical syndrome.
Oh, interesting.
Right? I can diagnose a patient with burnout now, and I've done that. So it's important in life beyond med school. It's important in med school too. I think it's important also to understand the early signs and symptoms, right? And that goes beyond just feeling exhausted. But if you're waking up feeling cynical about your day or cynical about your life, or you're starting to note as a med student, or you're starting to notice a decline in grades just because you don't really care anymore. You're like, why am I doing this? I mean, those can be some of the early signs. So in that case, I think it's really important to talk to someone, anyone, right? Talk to a friend, talk to a family member, talk to a professor. Right.
Yeah.
Because, if you start to get the conversation going, sometimes that can help. The other thing I think is really, really important here is to understand that, the path between burnout and major depressive disorder sometimes is a slippery slope. Right.
Yeah.
And so, again, if there are any feelings of guilt and worthlessness, or God forbid, any, suicidal thoughts going on, I mean, at that point, it would make sense to reach out to a mental health professional.
Great.
And I feel like in this kind of environment that me and him growing up is like always constant achievement that you're striving for.
Yeah.
I feel like there's a lot of, like burnout, you say. And kind of what you mentioned is like, kind of overcome that. There's like, evidence-based research on spirituality, breath work. It's always ways to overcome that. And I feel like, in general, for us, I've never thought of it in that way, of spirituality, breath work. It was always just, it was keep going through it,
Yeah, it's all connected to each other.
Yeah.
Right. And the other thing I think is really important about med school is, people who are attracted to medicine are obviously very bright, very intelligent, but there can also, I think in many ways, I'm not sure if evidence supports this, it could be a time where people are even more susceptible to burnout, in that medical school bubble.
Yeah.
Right. It's like they're always under this immense pressure to perform at a very, very high level. And the demands that the schools can put on students and students can put on themselves, I think can be tremendous. Now, one thing that I am really grateful for when it comes to U of H is I think that that's something that at least at this school we're aware of.
Yeah.
And we're talking about it, in leadership, and we want to make sure that our students are supported, and that their emotional well-being is supported. And I think you're starting to see that at other medical schools around the country as well.
Yeah, we had this conversation with Dean McCullers a little bit too, and he said the same exact thing. Like, UH College of Medicine is doing a great job with making sure it's more for like the people and helping them become better physicians in the future, so they can help the community out. So I love what U.S. College of Medicine is doing, you were doing, and thank you for that.
Yeah, I feel like support goes a long way, especially when it comes from your own school. So
Wonderful.
Yeah.
Yes.
And I kind of want to talk about one last thing was grounding practice or mindset shift. What do you think every ambitious person should learn before chasing their next milestone?
That life is not all about being ambitious, right?
Yeah.
I think balance is really, really important.
Yeah.
You know, I've unfortunately worked with a lot of people who have, you know, sort of dedicated their entire lives to this idea of success.
Yeah.
Right. And then they get everything they've ever dreamed of and then sort of reach the top of the mountain and just realize there's a wilderness on the other side. And they're like, this is it. Right. And so I think the way around that sort of starts in medical school. You realize that, yeah, you know, becoming a physician, whether you're going to end up becoming, you know, a neurosurgeon or hopefully a psychiatrist, because it's a cool specialty, right? But it's just one piece of your life. I mean, it's a huge piece of your life, an important piece, a noble piece of your life, but it's just one piece, right? You still have your family, you still have your friends, you still have your hobbies, and all of those are equally important parts of your life. So just approach this ambition, you know, in a very balanced way. And I think it'd be okay.
Yeah, and we had a neurologist a few podcasts ago, and he talked about rather than striving for happiness, you strive for wellness, because you won't be happy all the time in life.
I just gave a TEDx talk.
Okay.
It's called "It's Time to Kiss Happiness Goodbye."
I saw that video.
And I would encourage everyone to watch that, because this is actually something I've spent so much time thinking about. Right. Happiness tends to be this fleeting thing that comes and goes. And so typically when people think about happiness, it's hedonic happiness, like the feeling you get on your wedding day or when you honor a rotation, you know, or winning the lottery or whatever. You know, instead of focusing on happiness. And I mean, this is something that people can start doing as med students, focusing on this idea of fulfillment, you know, being grateful for what you have, being okay with who you are, being optimistic about the future. Being a medical student is a tremendous time to focus on fulfillment.
Great answer. All right, we want to next segment.
Okay, so I want to bring up a couple of questions that will be more for the advice for the next generation and the future of healing. So having seen mental health from so many angles, clinician, educator, author, what shift in mindset gives you the most hope for how society will approach healing in the years to come?
Well, I'll tell you that more people are talking about mental health, it seems today, than openly talking about it than, say, when I was a medical student. I think about, I think it was 2018 when Kevin Love, who's in the NBA, and DeMar DeRozan, another NBA player, actually wrote in the Players Tribune about their experiences with anxiety and depression. And that wasn't that long ago, but that was huge. Right. And so now you see more people who have these huge platforms coming out and sharing their mental health journeys and their mental health stories, to the extent that we're seeing mental illness almost becoming destigmatized. Right. And so, considering that in the United States alone, there are over 140 suicides on average every day, 40 million Americans struggle with anxiety. Depression is not that far behind. I think the more people continue to talk about mental health, mental illness, encouraging people to go to therapy and get the help that they need, I mean, that gives me a tremendous amount of hope.
Good answer. Second question.
We're on segment 5? Oh, wow, we go fast. All right. So what's one piece of meaningful advice you would give to someone who's trying to overcome an addiction? And what's some healthy habits or lifestyle changes that they can adopt to help them stay on track during the recovery? Well,
I think anyone who's struggling with addiction, again, I think it's really important to have a community, a supportive community there, whether, that's a sponsor, through AA or, a family member. Depending on the severity of the addiction, I think it's really important to have a mental health professional, a therapist, or a psychiatrist as part of that team. But addiction, I mean, there are all sorts of addictions.
Exactly.
Right. So we're not just necessarily talking about, substance use. I've worked with people who are addicted to exercise. Right. I mean, and it can be equally disturbing. Right. So I think it's important that someone who's struggling with addiction identifies a good supportive community that can be with them while they're working through that.
Yeah, and I feel like it's, again, like you said, there's so many different addictions. I feel like every addiction probably has a different, like, probably a practice to like follow and everything. So yeah, so really good advice for that too.
No, I love that.
Yeah.
Thank you so much, Dr. Brown. This has been an amazing podcast, an amazing episode. And I got to learn a lot more from you. And to everybody watching, hopefully you learned a lot from Dr. Brown as well and got some great full advices. And keep watching us. We'll be here.
And again, thank you so much for coming on. Again, I learned a lot personally.
Yeah.
I'm going to try that breath work for sure. And again, thank you for U.S. College of Medicine for allowing us to use their in-house studio. And Dr. Brown, if you want to shout out anything, if people want to reach out to you, where can they reach out to you?
So the best way is through my website at gregoryscottbrown.com.
And we'll link that down below.
We'll link it down below.
And then like and subscribe, share, and follow for more. Thank you guys so much.